Hi guys, this is a rapid review for pediatrics for the USMLE CK exam. I'm going to be covering high yield points that at least were very high yield to me. Okay, so a patient came with a bloody diarrhea and developed a seizure. What is the bug that we would think about? Is Shigella. How does Shigella present? So Shigella starts with a watery diarrhea. So the symptoms start abruptly and it starts as a watery diarrhea and then later on it becomes bloody diarrhea. Okay, now a patient had atopic dermatitis, then they developed papules on that area and the papules became pustules and the pustules became honey crusted. They erupt and they cause the honey crusting area, right? And it is painful and itchy. What is the bug that you should think about in this case? We should think about Staphylococcus aureus and Streptococcus pyogenes, right? How do we treat it? If it is a small area, we can give the topical mupirocin, but if it is a big area, we can give the antibiotic cephalexin, so we treat systemically. Okay, now how long after the exposure to rabies would the symptoms present? So a patient was exposed to rabies, okay? How long would the period be until the symptoms present? It would be about 3 months. So 1 to 3 months is the average. Okay. What about the symptoms? When do the symptoms of tetanus start? How long after exposure for tetanus do symptoms present? It would be 3 weeks. So don't confuse that. So rabies would be 3 months, but tetanus would be 3 weeks. Okay. Now, and what is the characteristic thing that you should look for in case of rabies? You should look for a tingling and numbness around the area of the wound, right? Through which they actually got the rabies, okay? Now, when you see a patient with ascending paralysis, what should you think about? You should think about rabies and Guillain-Barré syndrome. Okay, a patient has a thrombocytopenia, elevated liver function test, and low sodium, and they have a rash. So a patient has a rash, and when you do the lab test, you found thrombocytopenia, low sodium, and high liver function test. So what is the diagnosis in this case? Most likely it's going to be the rickettsia, so the Rocky Mountain spotted fever. And what is the treatment for that? It is doxycycline. Okay, now prenatal ingestion of unpasteurized products, what does it increase risk of? We know that this increases the risk of congenital Listeria monocytogenes. Now, what would be the symptoms on the mother during pregnancy? It would barely be any symptoms. It would be like flu-like symptoms, right? But what would happen to a neonate who got Listeria monocytogenes from his mom during the pregnancy? What is the risk for that? They are going to develop meningitis or sepsis, right? So that's why we don't recommend pregnant women to consume any unpasteurized products. Okay, a patient has sickle cell anemia and he developed fever and osteomyelitis. What is the empiric antibiotic that you would use in this sense? You would use ceftriaxone and clindamycin. Why is that? Because we know that osteomyelitis in sickle cell disease, it can be because of salmonella, right? But the most common bug is Staphylococcus aureus in everyone, but in sickle cell disease patients, they have an increased risk of salmonella osteomyelitis. Okay, a patient has come with a chronic cough. The X-ray shows a lower lobe infiltrate and hilar adenopathy. And the patient used to live in a shelter. What is the most likely diagnosis? Tuberculosis. Okay. Now, what is the most common bugs that are causing acute bacterial rhinosinusitis? Acute bacterial rhinosinusitis bugs are non-tibial Haemophilus influenza, Streptococcus pneumonia, and Moraxella. Okay, a patient came with fever and abdominal pain, rose spots, so rose spots rash, and hyperosplenomegaly. Fever, abdominal pain, rose spots, and hyperosplenomegaly. What should you think of? Salmonella typhi. Okay, how do we treat Salmonella typhi? Ceftriaxone. Okay, now a patient who's young, let's say 4 years, has fever, acute unilateral cervical lymphadenitis. Acute cervical unilateral acute unilateral cervical lymphadenitis that is tender and erythematous. He has fever and recently had an upper respiratory tract infection. What is the pathogen? What is the pathogen that we should think about when a patient has a unilateral cervical lymphadenitis? It is either Staphylococcus aureus or Streptococcus pyogenes. How do we treat that? We treat it with clindamycin. Why do we have to treat it with clindamycin? Because there is a risk of developing an abscess and requiring drainage. Okay, what if a patient has upper respiratory tract infection and a fever, and at the same time they developed a bilateral cervical lymphadenopathy? What should we think about? We should think about cervical lymphadenopathy secondary to influenza. Okay, now we've got a patient who's older than 3 months and has septic arthritis. What are the bugs that we should think about? We should think about group A streptococci, so Streptococcus pyogenes, and we should think about Staphylococcus aureus. Okay, now what is the treatment of congenital toxoplasmosis? Congenital toxoplasmosis, what should we give the patient? We should give them folinic acid together with sulfazidine and pyrimethamine. The folinic acid to compensate for the side effects of sulfadiazine and pyrimethamine. Okay, now a patient has a cherry red macula. What should you think about? 2 diseases. We should think about Tay-Sachs disease, and the other one is the Niemann-Pick disease. Now, what is the difference between Niemann-Pick and Tay-Sachs disease? The main difference is that in Niemann-Pick disease, there is areflexia, but in case of Tay-Sachs disease, there is hyperreflexia. Okay, now what if the patient had a rash that comes in the evening together with fever and then it disappears by the morning, and they have monoarthritis and fever? What should you think about? You should think about the systemic form of juvenile arthritis. Okay, now a patient, what is the treatment, or what should we give a patient who was exposed to hepatitis B perinatally? So perinatal hepatitis B exposure, what should we give to the neonate? We should give hepatitis B vaccine and hepatitis B immunoglobulin during the 12 hours after birth. Okay, now what is the treatment for strep throat? Is penicillin. For how long? For 10 days. Okay, and what if the patient has developed acute rheumatic fever? What should we give the patient? We should give them intramuscular penicillin G for years. Okay, so that's a specialist call. Okay, anyway, now what reduces mortality in measles? A patient has measles. What should we give the patient? We should give the patient vitamin A. Okay, what is the post-exposure prophylaxis for vaccinated people, okay, who were exposed to Bordetella pertussis, whooping cough? What is the post-exposure prophylaxis? Azithromycin. Okay, what are the causes of meningitis in patients who are younger than 1 month? Meningitis younger than 1 month, we should always think about a group B streptococci, so Galactia, E. coli, Listeria, and herpes simplex virus. Okay, what are the most common bugs that would cause meningitis in patients who are older than 1 month? Then we should think about Neisseria meningitis and the Streptococcus pneumonia. Okay, now what is congenital disease causing conductive hearing loss? Congenital disease causing conductive hearing loss. We should think about Alpert disease or osteogenesis imperfecta. Okay, now what are the causes of septic arthritis? What are the pathogens if the patient is younger than 3 months? Younger than 3 months, then we should think about Staphylococcus aureus. We should think about a group B streptococci as well as gram-negative bacilli. What if the patient was older than 3 months? What are the causes of septic arthritis in those patients? It would be Staphylococcus aureus and the group B streptococci. So if the patient is younger than 3 months, we would think that he has got the group B streptococci from his mother. But if the patient is older than 3 months, then we should think about a group A streptococci. Okay, now what is the treatment for osteomyelitis in a patient who has sickle cell disease? We said that it is ceftriaxone and clindamycin. Ceftriaxone and clindamycin, because we need to cover Salmonella and Staphylococcus aureus. What if the patient didn't have a sickle cell disease? So a patient has osteomyelitis, right? And he doesn't have sickle cell disease. What is the antibiotic that you should give? We can give vancomycin alone or clindamycin alone, but we can also give cefazolin or oxacillin, okay, depending on the resistance in the area to Staphylococcus aureus. So if there is MRSA in that area or not. Anyway, so there is a neonate who has developed sepsis. What is the empiric antibiotic in this case? It is always ampicillin and gentamicin together. Always 2 antibiotics, right? Okay, what if it was an infant with sepsis? Infant with sepsis, what is the empiric antibiotic? Empiric antibiotic in that case would be ceftriaxone and vancomycin. Okay, now what are the bugs that can cause preorbital cellulitis? Preorbital cellulitis, it would be strep A, Streptococcus pyogenes, or E. coli. Or Staphylococcus aureus. So strep A or Staphylococcus aureus, the same bugs that can cause MTGO. Right. Now, a patient has retinitis, for God's sake, okay. Chorioretinitis, intracranial calcification, seizures, and macrocephaly. What should you think about? Toxoplasmosis. Okay. A patient has rhinorrhea, skeletal anomaly, desquamation, rash of the palms and soles. What should you think about? Syphilis. Okay. A patient has cataract, sensorineuronal hearing loss, and cardiac defect, most likely a patent ductus arteriosus. What should you think about? Congenital rubella. Okay. Now, a patient has microcephalus, chorioretinitis, and there is a periventricular calcification and sensorineuronal hearing loss. We should think about CMV. Okay. What is the complication that can develop in neonates who got a congenital varicella zoster virus? Congenital varicella zoster virus. What are the complications? Meningitis, pneumonia, hepatitis. Okay. Now, an infant with conjunctivitis, with Neisseria gonorrhea, what is the treatment? What is the treatment of conjunctivitis caused by Neisseria gonorrhea? In that case, we should give 1 dose intramuscular cefotaxime. Okay. Next is an eyelid swelling with mucopurulent discharge, and the age is 5 to 12 days. That's chlamydia. Okay, what is the treatment of atypical pneumonia? Atypical pneumonia, azithromycin. What are the most common causative bugs? It is the Mycoplasma pneumonia or chlamydia pneumonia or viruses. Okay, what is the treatment of cat scratch disease? Azithromycin. What is the treatment of severe Campylobacter infection? In this case, we can give azithromycin or levofloxacin. Okay. What is the treatment of giardiasis disease? Giardiasis diarrhea. Giardiasis diarrhea, we should give tinidazole. Side effects of erythromycin in infants. It would be pyloric stenosis. What antibiotic do you give in epiglottitis? Ceftriaxone, vancomycin. Okay. What are the antibiotics indicated for? When are antibiotics indicated for acute otitis media? If the acute otitis media in a patient who's younger than 6 months, we always give antibiotics. Or if the patient is older than 6 months and has a very high fever or very severe ear pain or bilateral otitis media. Okay, when is a tuberostomy indicated? If the patient had 3 or more acute otitis media in a period of 6 months, or if the patient had a persistent acute otitis media for 3 or more months and symptoms of hearing loss. Okay, what is the treatment of otitis externa? We can give the topical ciprofloxacin, so fluoroquinolones topically. We can give also topical steroids together with the ciprofloxacin. What is the treatment of the chronic suppurative otitis media? It is also autotopical ciprofloxacin. Okay, what are the causative bugs of a chronic supportive otitis media? Suppurative, it is not supportive. Suppurative otitis media, then it would be Pseudomonas aeruginosa and Staphylococcus aureus. Okay, I hope you guys have enjoyed this video or found it any useful. Please leave a review if you did, and good luck.